This is the PDx Ear Exam. So to start off, I'm going to first observe the auricles, looking for any differences here, looking for any skin lesions, abnormal moles, the level of the ears, size, just checking for any abnormalities bilaterally. Next, I'm going to look at the ear canal, making sure there's no discharges, scales, anything weird there. Look good. Next, I'm gonna go on to palpation. So I'm gonna palpate your mastoids here. Let me know if there's any tenderness.
Good.
Okay. And I'm gonna palpate the auricles. Do the tug test here. Okay, there.
Mm-hmm.
Okay. Any tenderness there? Checking the tragus. Good here.
Mm-hmm.
Okay. Next, I'm going to get into the otoscopic exam. So here I'm going to start by looking at the external auditory meatus here. Looking for any erythema, swelling, anything like that. Scales, foreign bodies, and then I'm going to look at the eardrum. And I forgot to mention, but I'm going to pull up and back because he's an adult here. Okay. Looks good. See the cone of light. Color looks normal. No perforations. And then I'm going to check the other side. And here I would switch out tips if he had an ear infection or anything of that sort. That could be crossed over, but you're good here, right? Okay. So I'm going to go on this side. So I'm going to pull up and back here. Checking the external auditory meatus here. And then getting to the eardrum. And good. See the cone of light. Color's good. No inflammation. Erythema. Good. Next, I'm going to go into my tests. So I'm going to start off with the auditory acuity test. So I'm going to rustle my fingers on a side and let me know when you hear it by just raising that hand.
Okay.
So if you close your eyes for me. Okay. Okay. And comparing the distances, they're equal bilaterally. If they were not and I had an acuity loss here, I would go on to the Weber test. And so here I'm going to strike my tuning fork here, 512 hertz, and I'm going to place this on the top of your head. Let me know if you hear it in one ear or both ears, or what you hear. Don't hear it?
No.
Okay. Try again.
Okay. I heard it in both ears.
Both ears?
Yeah.
Okay. So let's say we had a discrepancy here. Then I would go and test each ear individually. And I'm going to do the Ryan test here. So this is where I strike here. I'm going to place it against your mastoid. Let me know when you can't hear it anymore.
Can't hear it.
Okay. And let me know when you can't hear it anymore.
Can't hear it.
Okay. And I'm going to check the other ear, checking the timing, making sure they're equal bilaterally. So let me know when you can't hear it anymore.
Can't hear it.
Okay.
Can't hear it.
Okay, good. For the sake of timing, I quit the vibrations, but that's the Ryan test. And next is going to be the Schwabach test. So here I'm going to test the conductive hearing of my patient and myself as an examiner. So I'm going to strike the tuning fork and place it against your mastoid. Let me know when you can't hear it anymore.
Can't hear it.
Okay, so I noted the timing there, and then I'm going to strike it as similar as I can prior. Test it on myself. And I no longer hear it anymore. So it's pretty equal. And I'll test both sides. And that concludes my ear exam.